Post-traumatic stress disorder, or PTSD, is a mental health condition that is triggered by a terrifying event, either experiencing it or witnessing it. PTSD is a widespread issue all over the globe. Many people wake up and face it every day. Many other people didn't sleep the night before. PTSD has been known by many names in the past, such as shell shock after World War I and combat fatigue after World War II. But PTSD does not just affect combat veterans. It can affect people of any ethnicity, nationality, or age. PTSD affects approximately 3.5% of U.S. adults, and an estimated 1 in 11 people will be diagnosed with PTSD in their lifetime. Women are twice as likely as men to have PTSD. High-risk jobs such as first responders have an increased chance of getting PTSD. Symptoms of PTSD often occur within 1 month of the traumatic event, but in some cases, thoughts, flashbacks, or nightmares may not occur for over a year. There are many symptoms of PTSD. Some common ones are recurrent, unwanted, distressing memories of the traumatic event, reliving the traumatic event as if it were happening again, flashbacks, or severe emotional distress or physical reactions to something that reminds you of the traumatic event. Intrusive thoughts can be debilitating, even to the point where they prohibit you from going about your normal daily tasks. One scary aspect of PTSD is that the symptoms can vary over time or vary from person to person, which makes it difficult to treat. There are no set guidelines for events that can cause PTSD, but some common ones that contribute to the development include combat exposure, childhood physical abuse, sexual violence, physical assault, being threatened with a weapon, being involved in or witnessing a car accident or death, or being kidnapped. Throughout the ages of the military, it was common practice to be debriefed after a traumatic event. While they thought this may help in the long run, it actually did more harm than good. Forcing people to talk about something that they aren't ready to talk about can actually cause PTSD in itself. Sadly, these people were mostly faced with the problem that they would not be able to return to duty until they were debriefed, so it forced them to talk about something they weren't ready to talk about. This practice of forcing debriefing led to a lot of people coming back from combat with severe cases of PTSD. A lot of times they did not get the help they needed, and it affected their lives tremendously. People would lose their jobs, their families, and end up committing suicide sometimes in the long run. Many people believe that PTSD is just all in their head and that they can figure it out on their own. But there is a true physical difference in the composition of a brain with PTSD as opposed to one without. It is important that people get the help they need, and treatment can be kind of difficult for PTSD. The most common treatment is medication, but to be honest, this may not be the best way to treat it. Psychotherapy is also another treatment option, but it doesn't work for everybody. Anti-anxiety medications are often used to treat PTSD as they are approved by the FDA. These substances can be abused, so it is important that you only take them for a short period of time. While anti-anxiety medications may work, they are not a long-term fix, so should be avoided. This lack of successful treatment methods for PTSD may have people feel like they're digging themselves into a deeper hole, and they might never get out. In many cases, people will not get any help at all. They will let PTSD control their life, and they will even try to self-medicate with alcohol or drugs, but this is not a permanent fix. Cognitive behavioral therapy can be very successful for some people. This therapy allows patients to talk with a therapist and help them get insight on what exactly is causing their PTSD and why their thought patterns are getting them in a rut. A relatively new form of therapy is exposure therapy. This is a form of cognitive behavioral therapy where excessive exposure to the traumatic event helps people cope with it. Patients are usually asked to retell the story of what happened many times over until they become almost desensitized to it. This is a very effective method of therapy for people with PTSD. There has been a lot of success from using this. It is important for people to get the right help they need because PTSD is not known to go away on its own. In some cases, it can last an entire lifetime of haunting images, thoughts, nightmares, restless nights. It is commonly quoted as being in a living hell. Due to the wide list of events that can cause PTSD, it is unlikely for it to stop being a problem anytime soon. This is why it is important that we develop successful methods of treatment for PTSD. One day, maybe we can live in a world where treating and dealing with PTSD will be safe and effective for everyone.